is a highly protein-bound drug. So that's why over here you need to know about their liver function. There are some adverse effects, which include lethargy, abnormal movements, and confusion. If the patient is on Dilantin for a long time, they can have other adverse effects, such as gingival hyperplasia, where there's overgrowth of the gums, acne, hirsutism, where there's like excessive facial hair growth in females or whatever. Dilantin facies, which is like a very round, puffy face situation. They just call it Dilantin facies. As well as osteoporosis. So this drug, Dilantin, has a narrow therapeutic index as well of 10 to 20 micrograms per milliliter. So another number to remember. So we have phenobarbital at 10 to 40, Dilantin at 10 to 20, and then down here we're going to get to another one. Phosphatoin is Cerebex. I think that's how you say it. I don't know. I'm pretty sure I've seen a commercial for that one before. Then this drug is a prodrug of fentanyl. So I'm just going to zoom in on that so you can know how to spell them. This is the Dilantin. And then this is the phosphatoin and Cerebex. This drug right here is a prodrug of this. That's why we have this little arrow right here. Prodrug of that up there. I wish I knew how to say these things, but I really don't. Okay. Carbamazepine. I don't know. Tegretol is the brand name. Thank you, drug companies, for having easier to say names. This is the second most prescribed drug, and this is for partial and tonic-clonic seizures. This drug will not participates. I guess it does participate in an auto-induction, which means it metabolizes itself. But for this drug in particular, you need to remember no grapefruit. So I guess we can remember that by, I don't know, if you smell a pine tree, if you smell a pine tree, you're probably not going to want to eat grapefruit. I don't know. I'm thinking like orange juice and like brushing your teeth with mint. Those two would not go well together. So pine and grapefruit probably wouldn't go well together. I don't know, but we're going to go with it. Okay, the last one we have over here for first line is Valproic Acid, and that's Dipakine. No clue. It's the therapeutic index for this drug is 50 to 100 micrograms per milliliter. It's generally used for generalized seizures as well as bipolar disorder. So you can remember bipolar disorder because there are two words right here, bi being two. So there's two words down here, and it can be used for bipolar disorder. It is the only drug over here that has two words. So maybe that'll help us remember it. There are some adverse effects for valproic acid, which include hepatotoxicity and pancreatitis. And this drug, as well as fentanyl, is highly protein bound. So that's something you're going to need to check with. Make sure you monitor their liver function. So over here, we have adjunct antiepileptics. There's not much to know about these, except, obviously, know this stuff in general because it's just generalized anti-epileptic information. We have clonazepam, diazepam, gabapentin, pregabalin, lamotrigine, levetiracetam, and topiramate. That's how you spell them. So clonazepam is Klonopin, diazepam is Valium, gabapentin is Neurontin, pregabalin is Lyrica, lamotrigine is Lamictal. Maybe that's how you say it. Levetiracetam is Keppra, and topiramate is Topamax. That one's so easy. It's like topiramate is Topamax. Like, they totally were like, oh yeah, we're just going to name it Topamax because we've got Topa already in there. But whatever, I'm cool with that. Okay, so diazepam can be used for status epilepticus. Gabapentin and pregabalin are used for neuropathic pain. We actually talked about those in a previous video. And then topiramate is just a general catch-all drug. So here are your anti-epileptics. I know I butchered how to say them, but I am not a drug company person. I am just a student. So hopefully this helps you, and we'll get on to the next one.